Yeah, we'll hope that Julie goes on. So Janet, do you want to go ahead and introduce?
Yeah, just who's got the slides?
I've got
Who's
the
got the
slides.
slides? Thanks for joining us. We were far more organised in the first session. My name's Janet Wray. I'm the designated clinical officer from Oldham CCG. So I've been working through COVID since March, and then since our additional lockdown restrictions from July, and then we'll just wait to see what happens today.
Julie has joined us.
She joined us.
Yeah.
Brilliant. Oh, lovely, thank you. So I'll introduce myself next, just to give Julie a minute. So my name's Gill Tyler. I'm the designated clinical officer, or one of them, for NHS Cheshire CCG. Cheshire CCG covers 2 local authority areas. We became a joint CCG in April during COVID, the merging of 4 CCGs into one. So that's been interesting in itself. And I face Cheshire West and Chester local authority for most of my time. And Julie, are you there?
I'm here now. Apologies, I was caught on a call then. There's never a minute, is there? I'm Julie Hoodless. I'm the DCO for St Helens and also for Warrington CCG. So I'm hoping you've met all 3 of us. Janet, have you introduced yourself too? Lovely. And Anna, we've got you as our facilitator as well, haven't we? Marvellous.
You do.
So we're here as 3 DCOs from the North West Regional DCO DMO network, just to share with you today our kind of experiences and how we've maintained service delivery capacity in the North West during COVID. You'll be aware that there have been several areas within the North West that have been on lockdown for a long period of time, and that we are on the brink of potentially being in tier 3 lockdown again. So it's sharing that with you. We don't think we've probably done anything different than you've all done, but we might have had to do it under slightly more intense circumstances. And really what we found from the first workshop is that it might be useful if you're in a position at the minute where you have managed to recover services really well. You might be on the point of another regional lockdown or a local lockdown going forwards. So the plan is that we'll deliver a 10-minute presentation, and then we can answer your questions or pick up any points that you want us to just go into in a bit more detail after the presentation. We've made it really simple, that we've kept the presentation to 3 slides, so 1 slide each, that represent the 3 key themes that we feel have been crucial in maintaining delivery capacity throughout COVID and ongoing in the North West. So we'll start with this first slide. So
is the first slide up, Julie? Because it keeps changing.
It is still, it's working this time. Brilliant. So we've headed this slide restoration and recovery because the decision from the start has been that we've worked with a vision in mind, that even back in March, if services had to pause or stop in completely, that at some point in the future they would need to fully restore. And that when we got to that stage, we'd want to be in as possible position as possible to go forward. So we've had that vision in mind, and that's what's helped us to really kind of maintain capacity. What's been really key throughout the process has been the timely response to the guidance that's come from NHS England, DFE, PHE, that when it's published, it's shared promptly and widely. And that's been really, really key, again, in terms of making sure everybody is on message for what the current guidance says. That's been really crucial for the Parent Carer Forum, who've been, just absolutely paramount in maintaining capacity and understanding the capacity that's available. So having very open and honest conversations with them about what the guidance that's been just published means and how it impacts on the services that they're used to accessing and they're familiar with, what those services might look like at this stage because of that guidance. So they've never had experience, as most of us working within the NHS have had, of services having to stop or partially stop or start to deliver in a very different way over a very short time frame, and communicating with them and help them to experience that with us and to share their experiences with us has been crucial. The key message to service providers throughout was that the send remains a priority, and send is business as usual. And although we really have wanted to really kind of understand that they have competing priorities, for us as DCOs, send is a non-negotiable, and that they know that we're always there to make sure that we're advocating for children and young people with send. So it's the key message, first of all, was around redeployment, and that we'd say to them, the messages that we had for key managers was that redeployment should only happen when it has to happen. And for those members of staff who have the key skills that requires an expansion of role to support the COVID response, so that we would understand that there might be therapy services who were redeployed to support discharge planning, for example, to increase capacity for beds where it was needed. Or we might have speech and language therapists who were dysphagia trained, who could be redeployed into the acute trust for as limited time as possible, really was the message. But what we were really discouraging was redeployment into generic roles, so that we didn't have those with clinical skills who were redeployed into contact centres and answering telephone calls. I work for 2 CCGs. One CCG I've worked for a couple of years, and their kind of attitude was very much minimal redeployment, maintaining service capacity. And those services have maintained a good level of capacity throughout and continue to do so. The second CCG that I started to work for after lockdown had started took a different response, and high numbers of staff were redeployed into the acute trust. And I'm talking over 50% for some services, and they were there for weeks. And actually those services now have got additional challenges with accessibility to their services, because they've got long waiting times and they've got backlogs of children to see on top of the current pressures and the current responses that they need to make. One of the key things I found was really emphasising the CQC domain of being well led with operational managers. That was crucial in keeping staff in post in order to deliver according to their expertise where it was needed. And then when the temporary modifications for SEND legislation were published, again, it was very much sharing those widely, communicating with parents and service providers to establish what reasonable endeavours would look like. And for different providers within an area, because we have several different health providers, to facilitate the conversation about what virtual platform they might use, what they might have had some success with, or if it was all brand new to them, to share their expertise so they had a virtual offer up and running very quickly. And I mean the first week or fortnight within COVID, so that again, I mean, for some services, they didn't have to cancel an appointment at all. So for our community paediatricians, everything shifted to virtual straight away. And they're really proud now that they didn't cancel any appointments. For some services, that wasn't possible and there were cancellations. But having that switch to a virtual offer that was absolutely acceptable within reasonable endeavours was really, really crucial. And it was encouraging everybody to understand what that would look like. And there were teething problems initially with the digital kind of presentations and that kind of thing, and how they'd worked with that. And then also it was, as soon as we had reasonable endeavours, it was encouraging them whenever we spotted that there was some particular examples of innovation or creativity, to capture it within a case study and share it widely, to share it beyond your service, to share it beyond your provider, and to really inspire others to work in that way, to think more flexibly. And I've got to be honest, to create that element of competition, which I always find quite useful, quite successful. The other key things as well, I think, as a DCO, we continually facilitate conversations between different partners within organisations. And Q&A sessions were really crucial to bring together health service providers and the Parent Carer Forum. I could see there was a message earlier on that talked about capacity. We lost our Parent Carer Forum lead for 4 weeks at the start of lockdown, and we were playing catch up from them. But after that, actually, we had increased capacity within our Parent Carer Forum, because they were so keen to know what was going on and what was going on. So QA sessions between health providers and the parents and carers was really crucial, so that the health providers would talk about their reasonable endeavours, and then the parent carers would talk about what the experience was accessing them. And it was just really, really powerful for our health providers to hear from those parents and carers what worked and what didn't work, what they liked and what they wanted more of, and to be able to facilitate that flexibility of the service so that they could offer something that was more fit for purpose for families where they were. All of this really helped to maintain SEND as a priority. And I think throughout COVID, the way it's worked, it's actually given us more, as DCOs, it's given us more opportunities to have SEND high on the agenda within our CCGs than ever before, really. So it's been kind of a blessing in that way. And the challenge will be to maintain it. But it kept centre priority because we had that delivery capacity maintained. So we were able to maintain health advice submissions within 6 weeks, apart from COVID-related exceptions. And there was reasonable endeavours to be able to deliver health provision in plans. You know, I will come on to an issue. We are in a different position now where we've not got those temporary SEND legislation modifications, and we are expected to deliver fully, but we're still under local lockdowns, and it's very difficult to be able to deliver what's specified in plans when we've worked so hard to actually improve the quality and the specificity within plans that goes down to a level of a session of not less than 45 minutes face-to-face with the child, with 15 minutes liaison with the teaching assistants in school, or to talk about delivery of interventions within a classroom. And we're very conscious that we're not delivering according to that at the minute because of lack of accessibility. I think the key thing that was a crucial point was when there was the phase 2 restoration of community services framework that was published. And again, it was making sure that all partners and all the Parent Carer Forum, again, were fully aware about what the guidance looked like now, so that all services, it was emphasised to them about section 21 and highlighting full restoration of services for children and young people with SEND and an EHCP. And we required all providers to reference that within their reset and recovery plans. So again, to make SEND a priority within it as they recovered, in order to maintain that delivery capacity as schools started to open. And to learn from their reasonable endeavours to create a blended approach, because we've never fully restored, because we've had different local areas locking down. Very quickly, we had about 2 weeks at the beginning of September where it was bliss and it was all working well, and therapists were getting back into schools, and we were dealing with the AGP issues, which Gill will come on to. But literally after that point, we started to have bubbles sent home, whole cohorts that were sent to self-isolate, and schools to close. So for us to maintain capacity when that happened, it was maintaining that blended offer so that we could switch very quickly, that if you phoned a school in the morning where you planned to do a school visit, you could immediately switch to that virtual offer of a Teams kind of meeting, or we were using Attend Anywhere as the digital platform to be able to offer something in that time slot and not lose capacity in that way. And the other thing all the way through is that we've been providing assurance about capacity to all partners involved within SEND, so that from the Parent Carer Forum to commissioners to health providers to local authority, that there was communication throughout via drop-in sessions, via monthly updates, individual responses to queries, that is basically our business as usual as DCOs, that the health offer throughout the pandemic, was there. It might look different, but it was there to meet children's needs, and that's been crucial throughout. Over to Gill for your slide.
Okay, so hopefully the next slide has come up. Obviously, when you're sharing your screen, you can't see it.
Yeah, we can.
Lovely, thank you. Okay, so I'm just going to talk about joint problem solving. When we were putting this together, we thought this was perhaps our next key area, or kind of summed up what we've been doing really. And I think this is what DCOs and DMOs do best. We facilitate partners coming together and working through and having those conversations to solve problems. We take a pragmatic view, but we want to work through, and we want to have the best outcome for our children and young people. And I think during the whole of this period, this is what we feel probably in the Northwest that we've been doing. And I suppose just to say this at the beginning, though we've been individually problem solving, within the Northwest we have regular DCO DMO forums, but they met bi-monthly. And so partway through the initial lockdown, we decided to meet fortnightly, just for an hour's drop-in. You don't have to if you're really busy, but otherwise you can just drop in. It's an hour again to share what are your problems of the week, how have you managed to resolve them, or can the rest of us in the Northwest help you in moving that forward. And we've reviewed that over time, but actually because we've had different areas kind of in extended lockdown or back into lockdown, particularly our Greater Manchester colleagues and obviously now within Liverpool, we've continued those fortnightly drop-ins for them. I've just put a list of a few of the things that we spent most of our time kind of looking at. It's not exhaustive, but it's just kind of perhaps the top ones. And no surprise at all, AGPs is at the top. I'm sure all of us have spent more time than we would have believed discussing AGPs, what the legislation says, the interpretation of it. Within the Northwest, we've also had our professionals, our paediatricians, put out what they thought would be a weighing guidance document, which may not have completely aligned with what was coming out nationally. And that led to a lot of discussion, both with local public health and with schools and even with families, because they felt that the consultants were saying one thing and maybe schools and we were going down a different route to do that. So I think through this, I think it's terminology, understanding, guidance, and what is an AGP? I think, you know, just back down to basics about ensuring we're all talking about the same thing has been key in trying to get these children and young people back into school where it's safe to do that. We've had some success in the Northwest, less than others, but then we've got shielding coming back. We've got anxiety where we've had increased lockdown in certain areas. So it's not all about whether we can safely carry out an AGP, that may be the issue that's stopping the return to school. Transport, I don't think I've ever been so involved with conversations about transport. I was pulled into conversations from about mid-June, end of June onwards, as we increased the number of vulnerable young people returning to school. And this really was particularly around our children and young people who may get anxious and show that by different behaviours, by spitting, potentially by biting, or for those that produce more saliva than normal and drool a lot. So had anxiety from the assistants on the transport, but also from parents of other children that may also be sharing that transport or using that minibus at a later time, and trying to work out the best and the safest way to enable all children to return to school. The return to school, we've worked with our mainstream and special school head teachers and head teacher associations to ensure a return to school. However, I think one of the things that particularly hit us in September was that individual schools had done their risk assessment based on what they thought was their guidance, but may have viewed that, again, a lot of the guidance has been slightly open to interpretation. So professionals, you know, in our case, therapists visiting schools, wasn't always allowed or agreed to begin with at the first couple of weeks in September. We had instances of timers being put on, so therapists could come in but only be with a child for 12 minutes, thinking that met the under 15 minutes of being close to somebody within their risk assessment, so that would be all right. Or they could only come in if they sat on a bench at the far side of the playground and not inside. So we've had to work through what that means, with really enforcing that reasonable endeavours has finished and provision in an educational healthcare plan needs to be delivered, in order that these vulnerable young people are back on their path to meeting some of that outcomes to do that. We haven't forgotten virtual. I think, as Julie just said, we now have services, I think, across the Northwest who are flexible. If they can do it virtually, they will do it virtually. But equally, if they've planned a visit and the visit can't take place, they can do it virtually. Or if we have part of our workforce who are at home because they can't go to work because they've got family who've been asked to self-isolate because a bubble's been sent home, or a year group from schools. So that means that they may need to be at home doing that, but can still do some work. So we've got a blended offer across. And as schools have been asked to do a blended offer, that they should be able to go from one to the other if children are off. That's how we're trying to work with our providers in the Northwest, that they can equally do that. Shielding. Oh, and we're just waiting for advice, or not advice, to change, more letters to come out potentially again. We've worked a lot over risk assessments about who should still be shielding, who shouldn't be shielding, but parents are really anxious. And I think we've done a lot of work with our Parent Carer Forum as well to get the message out about what the local advice is and what the national advice is, and trying to get that message across about risk assessments, conversations, communication, in order to encourage as many children and young people to return to school. Obviously, sometimes I feel that it's one step forward and two back with this, because as we've had greater extents and outbreaks up in the northwest, obviously parents' anxiety has increased again. So just as you may have felt that you've got somebody back, they've withdrawn and feel it's safer to have their child at home. So we are continually working that with that, and with our local authority colleagues about what do you put them down as attendance, how are you marking them there, and what is our local area view about attendance and shielding with or without a letter. And you know, we continue to work on a case-by-case basis, as well as a larger area view on that. Accessibility. I think accessibility of a DCO DMO, I think we all feel that Nevermore has our time been needed and warranted. And in some ways for me in part of Cheshire, which is quite rural, working from home has made that easier, because I'm not in my car travelling 45 minutes to a meeting. You know, I'm here and I haven't got that time. So in some ways I can fit a little bit more in. That may or may not be good for me. But we are accessible. And I think we're just continuing now to work with our providers about what we need to keep, what have we learned that's good, what to change that potentially hasn't, or we can just adapt to, and what to go back to. And Janet, I'll pass on to you.
Thank you. Is it there? So I think Christine said earlier, as we opened the meeting, as a SEND sort of service and as a system really that's responded to COVID, communication has been absolutely crucial. And I think what has proved invaluable is the working relationships that have developed across SEND. I know we had the discussion around the SEND reforms and the review, but actually SEND has probably been that one area where we've got that direction and that communication across sort of professionals and service users through co-production. And I think what we just wanted to do was just look through some of the issues, and I think some have come up in the chat around where the communication has proved beneficial and how we've tackled some of the issues that have arisen. So I think our children and young people and families, communication has been key. I think in the chat somebody mentioned the difficulties with Parent Carer Forum. Ours have managed to maintain a virtual offer, and they've been very proactive in that, and it was recognised at our recent SEND conversation. But they've been fortunate that very recently they've just been awarded some lottery funding, so they've set up a helpline. Now our work with Parent Carer Forum has continued through our written statement of action, so they've been very aware of some of the issues that have been arising and that providers are experiencing. So that was their natural response to how do we support this system, was let's apply for this funding and then we will work together. So they've been really proactive in that respect. But at a more operational level and sort of unpicking some of the issues that are arising through COVID, and also dispelling some of the myths. Our therapists and our community paediatricians, our children's services, they've been able to access the virtual tea and toast sessions. And as we've said, virtual working has its drawbacks and its merits, but being more accessible and having that additional time that we don't spend travelling or in offices has supported that attendance at tea and toast and other sort of forums with young people. Our local authority, as I've said, we've always had really good working relationships across the SEND system with the local authority. And I think in some respects that has been the learning through COVID, that we build on that. We've used our education, health and care plan processes if we've needed to bring professionals together around a family. Our shielding list which is now clinically extremely vulnerable children. We've worked together with partners to review that both strategically and operationally so that we've got assurance and a formal response. We've linked with our special schools and our mainstream schools, but brought together public health particularly, who've been absolutely outstanding through this response. They've been amazing in ensuring consistency of message and supporting schools, as we've said, with children that may be anxious or children that may be shielding or needed to shield, but ensuring we've got that consistent message across all services, and then being available, either myself as DCO, public health, or our infection control colleagues to offer bespoke one-to-one advice. We have linked in with infection prevention and control. We've supported the risk assessments, as have our specialist nurses and our school health advisors. But for mainstream schools, being conscious that this also, it doesn't just impact on the special schools, it is around mainstream and their concerns and the issues they're experiencing. We've set up weekly Senko drop-ins. So again, we've got a direct line of communication so that we can address any issues as they're arising in the real time. Health providers, again, it's just unanimous. We wouldn't have got through this without this collective communication and working together. They've been involved in all the recovery plans, providing assurance, but then supporting schools and children with disabilities services in sharing risk assessments, particularly around the AGPs and what constitutes an AGP and what doesn't. I've mentioned public health, and I think they should be up for some awards this year nationally for how hard they've all worked. But then thinking about our CCGs and also primary care, because again, there is that need to triangulate this information to make sure that if, for example, if shielding letters are being reissued to albeit a smaller cohort, that we've triangulated that with our community paediatrician advice, because our paediatricians have been excellent at working across the system and across all partners to review the most complex children. And then I've also added, just at the bottom, because it's based on the experience earlier this week, the communication with the DFE and NHS England in terms of the SEND conversations that have formed part of our written statement of action, because I felt that they've been the conduit really to support us and to support the wider DCOs through our communication channels in feeding back some of the issues that we're experiencing, and seeking advice around when will we see the guidance around AGPs, but making sure we've got that collective and that consistent message. And I think that's really all we were wanting to cover. We've certainly gone over our 10 minutes, and it's over to the forum really, whether you've got any questions.
Thanks, Julie, Gill and Janet. There's some nice alliteration there in your names.
We nearly went alphabetical. Oh, we did. Sort of.
So I suppose for any questions or reflections, that's a very impressive and reassuring response, I think, from your area. Feel free to pop it in the chat, or Karen, you've got your hand up. That's great. What would you like to tell us?
It was hello there. I'm from York. I'm not a DCO. I'm a hybrid role. I'm a senior quality lead. We are in the process of trying to appoint one. I was just interested in terms of how, in coming together as a system partnership across health, education, social care and the voluntary sector, in terms of resources. I know you talked about redeployment earlier, but I was thinking in the wider context of resources, anything you had to invest with, I know we had some COVID monies, but how, was there any gaps in that, I guess is what I'm trying to ask.
I think it's never going to be a clear answer, and I think there's been a lot of working together and there's been a lot of goodwill, but generally we've used sort of some of the panels and the processes that were already in place. I think we've probably exhausted our COVID monies now, but as I say, we all recognise that push to, we talked about integrated commissioning on the last call, that this might be the driver to say, actually, this is what we need to do, because these are the processes and the pathways, and it might be that this is the only way we can address it, because we don't actually know how long this is going to progress for.
On the last workshop, I was on the talk about digital platforms, and they said one of the issues were, well, virtual working was fabulous and it's the way forward for many of the issues we face. Many families do not have access to virtual platforms, so they'd got some money. They'd been to a local charity to get some money for this, so even if they had a laptop, they didn't have the Wi-Fi. So it was things like that, really, in terms of we can all see some of the benefits of the virtual working, but equally, if there's only one computer in the house and there's a family of 4 children and there's all these issues, did you experience anything like that? Or
I think we did in Oldham a little bit, and I think the schools were really sort of supportive in that respect in terms of provision of laptops and sort of any additional equipment, particularly for the SEND group. I'm not sure about Wi-Fi, to be honest. I think because we're in quite a dense population in Oldham, I think most of us, I don't think that digital poverty has hit that side of the economy.
Right.
Certainly for hardware, but I don't think for Wi-Fi.
Okay,
Sure Jill's got a response, being rural.
Yeah. And no, I am aware, so I haven't been so involved in that, but that has been discussion within our local partners very early on about, back in March, April, about who's got laptops, who hasn't got laptops, who's got things there. So our special schools sent those out, but then did find that some of them didn't have enough, either, my terminology to be wrong, broadband width, or they relied on a smartphone probably, and just had it on there. So I am aware that we have actually paid for some people to have a Wi-Fi connection, is how I'm going to do it. My phraseology will be wrong, but
no, it's fine.
In order to do that. And I'm pretty sure, I haven't got anybody from Liverpool on here, but I'm sure that Liverpool did quite a big piece of work about that, because we looked at our areas of deprivation in Cheshire, and looked at kind of cohorts around there, in order to do that. But I have to say, we also worked with individual schools, and if they had pupil pyramid funding and other funding streams like that, we were also working with our schools about what were they doing to ensure provision was still going on, and that they could do that they actually had a responsibility. So we did push back on our schools about what they were using their different bits of funding for.
Okay, thank you.
Sue, do you have a question?
Hi.
No. Oh, yeah, hello.
Sorry, it was just coming off. It takes a while, doesn't it? It thinks about it and then it comes off mute. Hi, I'm the DCO for Kenton Midway, down in the south compared to you up in the north. So I was the one who put in the chat box around the parent carer forum. So we've had some real challenges. I work with 2 areas, one parent carer forum, very engaged and active throughout the whole COVID period, and another very much more an immature organisation, because they've only recently developed, where we had a long period of time where they weren't engaging with us. So we've had to use really different ways of trying to communicate with families and children, young people, which made things really difficult for us, and how we engage with schools. But I think the most positive thing for us was actually that the virtual world, where we have been able to have really meaningful multi-agency conversations in a much more timely way than we ever would have done before. And particularly for me, local authorities saying, no, we can't do things virtually, we haven't got the technology, blah, 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 when all of a sudden overnight they needed to have it, and we're very, very quick in getting that. So we've had some really fruitful conversations around with our system, if you like, which didn't take place before, and we want to keep some of that going forward into good practice. But so I haven't really got a question. I was just saying, some of those things that, and really interesting in my area, I haven't been dealing with AGPs at all, which is really really funny, because my placements team have been doing all of that. We're such a huge area. We have like 600 schools. I've got 15,000 EHCPs, and I haven't got the capacity to be dealing with that. So it's interesting how other DCOs have been really involved in that and others have not had any. I mean, I've been keeping touch, but I haven't had that day-to-day conversation with it, which has been blissful.
I think that, just to say, I think that's really interesting, because during our same conversation, it was, tell me who they are. Yeah, what's the plan? So I think that's where, possibly because we've got the written statement of action, that's where this
huge one of those.
Yeah. But yeah, no, it's been very high on the agenda. Possibly because I'm a nurse by background. I'm not sure about the others, but no, it's been very high.
No, it's very high, Janet. I'm not a nurse background, but very high. But I do, it's just how you divvy up your work, isn't it?
Yeah.
But I do know that the DfE have asked numbers and assurance from each.
Yeah, we've been getting that sort of high strategic level, but the day-to-day, nuances about getting that particular individual child into school is not something that I've been.
I suppose it's been about the assurance on it, so that part of my role will be the assurance that we're doing that provision. So it's been assurance that we've done a joint risk assessment with the family, that they've had the PPE in, that there's space in the school for them to do the AGP, and that all their provision is provided. Again,
and that assurance doesn't come from the DCO role in Kent, it comes from a different team. So it's just interesting how it works differently. And bearing in mind the DCO role before I took it on last June never existed. So there have been a lot of people doing elements of the DCO role around Kent, and continue to do that. So trying to pull some of that responsibility back into a role that never existed before that has been a challenge. So,
make the most of it for now.
There's so much other stuff to do. I'm quite happy to leave some of the stuff to other people. Thanks, nice speaking to you anyway.
Thank you.
So Laura just made a reflection in the chat that some local authorities still don't have the tech or can't access the tech, which I'm sure doesn't help. Sounds like that wasn't such a challenge. Some of the platforms you talked about, I'm surprised that for NHS, I know there's always kind of NHS firewall issues, but that sounds like that maybe wasn't such a big issue. It happened pretty quickly that you could get it. Any other thoughts, questions, reflections from your own areas? Anyone else on the call? Uh, 2,400 plans in your local area.
Oh no, sorry.
Oh no, and growing, Anna, and growing.
Gosh.
And I just think that's because we're about 2,700, but that was really interesting, that earlier discussion around the impact of the reform, and it hasn't necessarily done what it was expected to do. So it's good to hear that.
I only dream of 2,000. When you've got 15,000, it's a massive ask.
Crazy.
I think the original reforms, weren't they? They were set out, was supposed that intentional was to reduce the number of educational statements, and they've actually quadrupled, and it just doesn't seem to be going down, it's going up. And I think the comments in an earlier session which said it's parents felt that was the only way they could get the support that they needed, and that was potentially one of the reasons for the increase, which is sad really, isn't it? And we all know that early intervention, early support across all services is really key, but it's having the vision and the leap of faith with investment to deliver on that, I think, is a struggle. When we're all, also we're overspent as a CCG, as I'm sure many other areas are as well. So it's about prioritising, it's making that pitch to your own CCG about where we can have some impact.
Yeah, we've just merged 8 CCGs together in April, so to have that voice in that big platform is something we're really working on.
I think the worry is as well, because part of the restoration and recovery plans, because cancer diagnosis, long-term conditions, that everything is behind. There will be a request from all those services to say we need the money because of this, etc., etc. So it's just trying to work together on that really, but it will be challenging, I've no doubt.
Thank you. Any other points? I know we're getting towards the end of the session.
Just it's really nice to speak to other people about these things actually as well. It's, you know, you feel you're not alone.
Similar challenges.
I think that's the beauty of the Northwest DCO network, that we do have, we know each other well enough now. We were established enough as a group.
We've got a really good SE19, we call ourselves, DCO network, which has been really helpful through this period, because we get together really regularly.
I think the DCO role, because you're the only one in your whatever your locality is, it could be quite isolating, I guess. So it's good to have that peer support. So my colleague has popped in the chat the survey link for the full afternoon. So if you do have a minute or two just to fill that out, that would be great. Also focusing or thinking about what you might want us to focus on for the next session in December. Anything that you think we could cover or get someone to speak about in a bigger session or a workshop. So yeah, before we finish and say thank you, any other questions or reflections? Just give you a minute to come off mute or write something in the box. I'm not sure if I can hear someone typing or not. I will just say thank you to Jill, Julie and Janet though, because that was very interesting. And like I said, a very reassuring response. I'm sure it must have felt massively daunting at the time and still does. I guess it's changing.
Thank you.
Thank you very much.
Thanks all. Bye.
Bye.
Take care, everyone.
Thanks. Bye.